Unit 9, Meeting Basic Human Needs. So human growth and development. So these are a couple of terms that are often used interchangeably, but they really have two kind of different separate meanings. So growth involves changes that take place in the body, so physical level changes that happen over time. So like the name suggests, growth. Development, though, is the changes that take place on a social, emotional, and psychological level. So often you'll hear them, growth and development, in terms of kind of how someone's doing. Like, for example, a great example is going to be a child. So a child's growth and development, are they at 2 years of age doing what they should be for that age? Are they growing appropriately? Are they also developing appropriately? Are they able to do the tasks that they should be able to do by that age? So they follow a basic set of principles of progression. So that you're going to move through the process. You're going to learn to walk before you run, for example. So you're going to master a certain task and then move on and build upon it. So progress and building. So it's a continuous movement from simple to more complex. So it's going to be, again, the walking to running. So from something simple to more complex, progressing over time. And then it's also going to move from head to feet, so starting at the top of your body, and then from torso to limbs. So you're going to work on your gross motor skills, your larger muscle groups, before you are able to master your fine motor skills. So another graph here, basic human needs. So you may have heard of Maslow's hierarchy of basic human needs. And basically what this hierarchy is suggesting is that there are certain levels to human needs, and you can't move beyond the level you're on until these basic levels are met. So the physiological, so breathing, food, water, sex, sleep, homeostasis, excretion, these are basic level human needs. So you're not going to be able to, be doing self-actualization before you've mastered these basic needs. So if you're having difficulties from disease or illness or sociological issues to not meet these physiological needs, you're not able to progress up this hierarchy. So the most basic human needs include nutrition, so giving our body energy it needs, rest, oxygen, shelter, elimination, activity, and sexuality. So these are the bottom level needs that Maslow suggests. So again, without these, we aren't able to move up the hierarchy to these to the needs above this. Security and safety needs, the next level on the hierarchy. So this is reducing or eliminating the threats to body or life. So knowing what to expect from others. So again, sort of developing this sense of security and safety. So again, it's not able to be reached unless you've already met those basic bottom level physiological needs. So the next rung is emotional. So the need for the following, so to give love, to feel love, to be loved, to be treated with respect and dignity, and to feel that your self-esteem is protected. So your self-esteem is really your opinion of yourself. So again, so you're going to start with the basic human needs, move on to safety and security, and then this next level is this emotional level, kind of focused around love, respect, and kind of being able to appreciate not only yourself, but to kind of give and receive love. So intimacy, so this is a feeling of closeness with another human. So feelings of love and affection. And then again, we think of intimacy as often just between lovers, but it can be shared among friends as well. So this feeling of closeness is what intimacy is the definition. So human touch, non-sexual touch can satisfy a patient's need for human contact, and there's been more and more research studies around human touch and healing touch. And we talk a lot about cultural restrictions and being mindful of how you touch somebody, or to make sure that that it's wanted touch. But again, I don't want you to shy away from touch, especially our elderly folks. Giving that human contact, that human touch is so critical to, health and well-being, that I want to make sure that again, there are some cultural things to keep in mind, but it is very, very important that you still provide touch, particularly as people age. There was a a research study that they had done actually in with infants in an orphanage overseas, and they found that the infants that were not picked up and touched and cuddled and loved, they actually had physical level problems, physical manifestations of this lack of human touch. So we're really kind of social beings, and we crave and desire closeness and human contact. So patient privacy. So as you went to your clinical, I'm sure you were aware of kind of how much privacy is given up when you move into an institutional setting. So for those of you who have yourselves been hospitalized, for example, so maybe when you've delivered a baby, you're aware that, yeah, every 4 hours someone's coming into your room doing vital signs, or, you know, waking you up, or doing this or that with the baby. So you're aware of kind of that lack of privacy. So, you know, the patient just naturally gives up a fair amount of control over their life and their schedule and their independence. And so we really need to be mindful of giving them as much privacy and as much independence and choice as we possibly can. So the patient's expectation is that their rights will be ensured. So again, in previous units, we've talked about this in terms of a patient's rights. So the patient's rights, the resident's rights, or the client's rights. So depending on where you're caring for them. But a big part of that is that right to privacy. So spiritual needs. So again, spirituality is a bigger kind of umbrella over religion. So someone may not have a certain religious preference, but still have spirituality and have spiritual needs. So often when a patient is fearful and ill, when a patient's approaching death, they're going to be more spiritual or more interested in kind of connecting to spirituality. So again, another patient right. The patient has a right to believe or not believe in any faith system. So again, if you are of a particular religious group, you're Roman Catholic, for example, you will come across patients every day that don't have a similar belief. And it is their right to believe or not believe in what they choose to. And so as healthcare providers, we absolutely have to respect that belief. So you're not going to push your beliefs on anybody else. They're able to believe, you know, exactly how they want to believe, and we help promote that. So if they are of a certain religious group and there's, you know, Sunday church, and that's something that they desire to do, it is our job to make sure they are aware of that and are able to attend, and we help assist them to attend if that's important to them. So listening to the patient. So again, especially if someone's going through an illness, a disease, or they have a terminal diagnosis. So listening and being aware and being present with patients is really important. So often a big part of your role is going to just be listening and being there physically for the patient. So the role is to reflect the patient's ideas, not to convince the patient of your own ideas. So, you know, same idea with spirituality. You're going to make sure that the patient is given what they desire in terms of their spirituality. So if that means getting in touch with a priest, if that means getting them to be able to go to church, if that means accessing other resources, that is our role to kind of reflect those ideas and make sure that the patients have what they need. So social needs, these are met by interactions with others and opportunities for free personal expression. So this is the overall goal is to increase self-esteem. So in the Eden philosophy, so though when you read about the Eden philosophy in your experience prior to Collar Lutheran Home or Lutheran Medical Center, it's really important to kind of understand that what they talk about in terms of meaningful activity. So this is going to vary from every single person. So every single one of you, every single patient, every single resident is going to have a different sense of what meaningful activity is and what personal expression is. So we need to essentially find out from our patients and residents what that means for them and how to make that happen. So being able to be social and to have opportunities where they can have meaningful activity. So to feel purposeful is very, very important. So our job is to find out what that is for that person and then be able to access resources so they can meet this need.